and raved about my irritation.
No, it's good. I was like, yeah, go, Shannon.
Okay. I mean that we have to wait for the New York Times to
Uh-huh.
a left-wing news outlet to bring us the truth about the elaborate, layered, sophisticated operation to save the Tate brothers and
Hmm.
acclimate them to conservative. It's insane.
Yeah.
It's insane. And Tucker mocking it, I mean, that just really set me off.
Hmm.
That really set me off. So, we're going to keep an eye on, and that was put in place in 2020, and it's still in place today because we're still under the emergency declaration that was issued by not only the former HHS administration under Trump, then Biden, but now also being continued by the current HHS administration under Bobby Kennedy Jr. Very important voice of clarity. She is independent. You can follow her at Due Diligence and Art on Substack. And you have a lot going on, Sasha. Big bombshell. Hundreds of thousands, you said, comments. Now, here's the headline from Children's Health Defense.
Hmm.
They're asking the FDA to revoke COVID vaccine licenses, calls on public to submit hundreds of thousands of comments they have in the span of 2 days. And this petition is based on the research, the critical research of pharmaceutical medical device industry veteran Sasha Latipova with us today. And it's asking the FDA Commissioner Marty A. Makary to determine that the two mRNA vaccines, Comirnaty and Spikevax, are misbranded and adulterated. This could open up floodgates. Let's hear about this first, and then we'll talk about other areas within medical, the genre of medical freedom, because there's a
Hmm.
lot going on, and I haven't done a show on this in a while. So thank you for being with us, Sasha. Appreciate you being here.
Well, thank you for inviting me. And yes, this is the topic I wanted to discuss today, to focus more on this topic. And this may be somewhat more familiar to your audience than others. But over years we've discussed the status of EUA countermeasures that these vaccines went on the market as under PrEP Act Declaration of Emergency, which is still extended. The HHS and FDA can simply make a bunch of bureaucratic announcements and determinations and put products on the market without any consumer safeguards that are expected by the consumers. We have extensive law in the US, generally summed up as CGXP, or good manufacturing practices, good laboratory practices, good distribution practices, and so forth, everything related to drugs and food in consumer supply. And so during a declared public health emergency, all of that law becomes irrelevant and
Mm,
suspended, and
wow.
consumers have no idea about it. Nobody was told this. I didn't know this, even being a professional. It took me several years to uncover what exactly they are doing and how they're getting away with this
Yeah.
crime, essentially. The FDA was founded because the justification of that agency was to safeguard consumer supply of food and pharmaceuticals in the US and regulate interstate commerce in those products. And the justification was because we want accurate labeling and we want to prevent misbranding and adulteration. Misbranding meaning calling something that it's not on the label, or making claims that are unfounded scientifically on the label.
Mm,
And adulteration is not having the correct ingredients, or having wrong things in it, or things that are not supposed to be there, potential toxic poisonous substances in the vials due to accidental or intentional adulteration. And so that whole justification for the FDA and the whole body of law that exists to safeguard this automatically gets suspended on a say-so of HHS secretary. HHS
yep.
secretary makes determination that he thinks that an emergency of chemical, biological, radiological, and nuclear weapons. This is what PrEP Act is designed for seaborne attacks. So he makes a determination that we're under attack, or we are under a potential attack with a seaborne weapon, and issues this declaration, which is what they did in 2020 for COVID. And today, it's absurd to believe that we have an emergency of COVID in this
Right.
country.
Right.
Yet this declaration remains in place. And the sole reason why it remains in place is to provide thorough liability shield for Pfizer, Moderna, and other producers of COVID products. It's not just the vaccines, it's everything.
Mm-hmm.
And thorough liability shield to the entire healthcare system that delivers all of that stuff. In fact, in the most recent declaration issued by Javier Becerra, outgoing HHS secretary, they've expanded it to include flu shots, for example.
Wow.
People don't
Wow.
know this. And to include as covered person who receives that liability shield from the government, everyone who can possibly be near a patient in a healthcare system, including not just doctors, but also pharmacists, pharmacy assistants, physician assistants, nurses, nurse assistants, unlicensed students too. So this now has morphed into we're just going to turn off litigation, turn off any ability of citizens to hold people who are performing malpractice on them liable. We're just going to turn it off completely through this method of expanding this PrEP Act declaration to infinity,
What?
So that's what and our petition says, hey, let's start rolling this back because first thing, these products should be deemed adulterated and misbranded, and we list dozens of pieces of evidence that has been accumulated, and this is primarily my research into the regulatory fraud. Essentially, if you're claiming this is a BLA, then it should be deemed regulatory fraud. What Pfizer and Moderna did. And so we're outlining all that evidence, and we're saying, FDA, you should determine these things misbranded and adulterated, and you should revoke the BLA licenses as you have full enforcement power,
Right.
including up to violence. FDA can send tanks and helicopters to burn down your farm if you're selling raw milk and they don't like it. Yet here
Wow.
they sit powerless. And, Marty McCary is sitting on his hands and saying, well, I can't do anything because, reasons. So we're saying, no, you can. You have the power. You can find them misbranded and you can revoke those licenses. Or alternatively, if these things are EUA countermeasures and you don't have that power, then, well, you can properly label them as EUA countermeasures. And then inform the people that they have no rights with respect to these products.
Oh, two choices there, right? Tell
Mhm.
them the truth, pull these off the market, or tell them the truth about the fact that they are countermeasures, which are military. It's military
Mhm.
designated bioweapons,
Yes. Yes.
essentially, right? So let's slow down a little bit, that because there's a lot there. By the way, recap, this is a big story. You said 200,000 already, or hundreds of
Uh,
thousands of.
yes. So the petition has been there for 2 days. We already received, and I'm so thankful to all of the followers and subscribers who commented.
Yeah.
We already received, as of last midnight, 100,900 comments, and this is on delay because they actually the system has to review the comments before they publish them. So
Wow.
we are expecting a groundswell.
Yeah.
This is unprecedented, and no other petition of CHD is telling me that no other petition was like so fast, so many comments, and
Yep.
we're so excited about it.
Yeah.
Yes, and we ask people to please continue sharing, please continue. The good thing about this is a formal process. It's not like a political petition. It's not
Mm.
just, sign, provide your signature. The FDA has 180 days to respond to us, but they also must review all the public comments. And the public comment section there is good because you can put up to 5,000 words and
Wow.
attach up to 200 megabytes of attachments.
Wow.
We're asking people, this is a place for you to provide your story of injury, your story of death of a loved one, of a child, a loss of job, anything related to this, or even submit your own research and analysis that you've done on the data or some relevant documents. And so that should push the HHS and put pressure on them to do the right thing.
Yes. And so this is from the piece, which is linked in the show notes of the Shannon Joy Show, which you can link to sign this petition or comment on this petition and tell your story. So this is essentially an airing of grievances for every single person who was harmed in any way in the dark days of 2020, 21, 22, with the rollout of the shots, by the countermeasures that were put in place. Does this include vaccines, vaccination, masking, loss of school? Does it include the horrifying, horrifying torment and torture that was experienced by hundreds of thousands of elderly people in nursing homes, the torment and torture of families who couldn't see their loved ones when they were suffocated to death on ventilators and given remdesivir, the COVID kill protocol that destroyed the lives of so many in those dark days since the lockdowns? Is it all of it, Sasha, or just the shot?
We're petition is focused on mRNA vaccine, they call them platforms. So that's our focus. However, we're encouraging people to write anything you think is related to it,
Okay.
including the stories with the COVID hospital protocols, because all of them are countermeasures. All of these products have the same issue as what we're discussing with mRNA. mRNA is the most glaring one because it's the platform that was never going to get approved under normal regulations. They tried for 20 years, they failed because it's super toxic, it kills people. So with full knowledge of what it does to human body, they decided to pull this hoax of a pandemic and invoke all these emergency military laws in order to push these platforms on the market. And now they call them fully approved. And that's the key of the deception. This is what we call the magic leap. They never complied with BLA standards because they went on the market as an EUA countermeasure. And then in 2021, Peter Marks simply relabeled them. So that's what's called mislabeling. So he mislabeled them and said, now they're fully BLA approved because I say so. Well, guess what? He doesn't get to make the law. FDA doesn't get to make the law. There is the law in the US, and it's very clear. What they have done in 21 is mislabeling, misbranding, and pushing on the market dangerous, adulterated products. And so we are asking them to do the right thing, correct their actions. And in fact, if they don't do it, the CHD reserves the right to sue them.
Absolutely. The story, CHD asked the FDA to revoke the COVID vaccine licenses. They filed what is known as a citizen petition with the FDA. This is based on Sasha Latipova's exhaustive work, along with
Exhausted too.
researchers, exhausted and exhaustive, along with Catherine Watt and Debbie Lerman and the folks over at CHD. They've done a lot of work together. This is an amazing partnership, an amazing collaboration. I'm so thrilled. I'm so proud of you. I'm so proud to be your friend and to work with you on these things, Sasha. I mean, girl, we've been in the foxhole together for about 3.5, 4 years on this. And it's astonishing. It's even getting some play on left wing as well. You were quoted. Well, I'll ask you about that in a moment, but just so you guys understand here, this petition, the citizen petition, is a formal request by to the agency, is FDA, to take regulatory action. Citizen petitions are typically submitted by an organization, and they require extensive documentation of the issue and the legal basis for the claim. So this is not your grandma's petition. You're not going to the website and putting this is something that you can also participate in. They're asking for public comment on this petition, and we are linking it in the live chat. It's also linked up in the show notes as well. This is making its way into mainstream. Did the New York Times reach out on this, or is there any covering of this petition? I think they asked you for a statement, Sasha, which is huge. I mean, what would you say to normies on the left? What would you say? I mean, this is beginning to permeate into the culture at large, which is a huge victory. But tell me about that, how we're beginning to get some play from left-leaning news outlets as well.
Yeah, so interestingly, yes, New York Times reached out. I did talk to a reporter there, provided a quote. I don't know if they will publish or when they will publish, but they did reach out. So, and good, they were frankly polite. It did not look like a hit piece. And I've been approached before. For example, journal Nature approached me with obvious attempt at writing a hit piece, and I generally give a very different response in that case. But in this case, kudos to New York Times. They were very polite. They were interested in the right kind of information. They asked good questions. It seems that they have
Wow.
reviewed my previous materials and understood what I was saying. And so, we'll see. Let's see what they put out, or if they put out. But that's a good sign, because they understand that there is this issue, and somehow it will become very key in midterms. And I'm not, I don't have any like rosy glasses about New York Times. Obviously, this
Right.
is all political. But hey, if they are willing to speak about the right issues and make our voices heard, well, all the power to them.
Hey, I mean, I spent the first 45 minutes of my show using the New York Times reporting on the Tate brothers and their connection to the Trump administration. Extraordinary, right? That we now have to go to left-wing news outlets to get some semblance of truth. It's because everything has become so political. But this is also very, very, again, this petition has garnered almost 200,000 comments in 2 days, which is extraordinary. It's a collaboration between Sasha Latypova and Children's Health Defense, longtime allies of Bobby Kennedy Jr., who is now working at the pleasure of the President of the United States, Donald Trump. Sasha, this is extraordinary. You've worked closely with Mary Holland, the president of Children's Health Defense. Mary Holland has been a long time supporter of Bobby Kennedy, but this is going squarely at Bobby Kennedy's FDA. I mean, this is going squarely at that organization, CHD reserving the right to sue them if they do not comply with responding to this petition. What do you make of that? I mean, that makes this all the more extraordinary. How did this collaboration come together? And where do you think it's going to go?
Well, yeah, so this is actually not the first time. They already sued Bobby Kennedy and won. So
Yep.
that was the fastest legal
Yes.
victory. Ray Flores filed a lawsuit to reconstitute the Vaccine Safety Task Force
Yep.
at the HHS. And so that was complied with, pretty quickly, within a month, I think.
Yeah.
So it's not the first time that they actually, sort of using the adversarial system to communicate with HHS. Now here it's not adversarial. A petition is a petition. As
Right.
citizens, we have the right to petition the government. We're just asking them to correct their actions and pointing to what's wrong. But they are serious. Yes, I started. Well, I've known Mary for quite some time now. We've interacted many times in many forums, and we did have a discussion about this. I was urging HHS, if we understand the constraints of the Trump administration, let's say Trump is very pro mRNA platform. Well, understanding those constraints, I was advising and urging people to push for disclosure. Okay,
Right.
you can have a political agenda of administration, and they, by the way, change over time. So,
Right.
but you are not allowed to lie to the public. So all we're asking is be truthful, either revoke those licenses or properly change them to the correct status of the shots, and explain to people what that means. Explain to people what countermeasures mean. They never did. They never did. They lied about it throughout.
They certainly did. And, I think that this is proof, and I'm really glad that CHD is doing this. I'm really glad that they are pursuing this. You and I, along with Mary Talley Bowden and Naomi Wolf and Dr. Peter McCullough, I mean, we've come out under a lot of scrutiny and attack.
Mm-hmm.
Bob Malone calling us a hate group at one point
Mm-hmm.
and blocking us all from
Uh-huh.
within the administration. Everyone telling us to, be quiet, give them time, play nice, try for access. You know
Uh-huh.
what I mean? Like handle them with kid gloves. And
Uh-huh.
at one point, we came to the determination that you can't play nice in all of this. Now, I'm
Uh-huh.
not saying that that you call them names or anything, but you got to play hardball with these people. If you don't think
Uh-huh.
that pharma isn't playing hardball with these people, you don't think that the
Exactly.
military and the medical industrial complex, the people behind the scenes and all of this aren't playing hardball with our politicians. You think
Yeah.
they're waiting for them to ask and asking politely for them to do the thing? Hell no. Like
Yeah.
we got to go out there and these are the bold actions that I've been waiting for. And so I thank you for your voice. It's really important.
Thank you.
Yeah.
Yeah, I'm waiting for DoD affiliated Robert Malone to explain to everyone what countermeasures are. And has he done that? No.
He is not.
You know,
No.
he's
So
the expert. He's the
he,
expert. He worked with DoD all his life.
that's right. That's right. You guys can be, this is really important. This is an important one. This piece, the piece to the CHD report on this, and which will feature links to the petition where you guys can get involved. You can tell your story, 5,000 words, and you
Hmm.
can attach documents. If you have research studies, I mean, this is where Tom Haviland needs to go with his information on the white fibrous clots. This is where John Bodewin, with all of his information, the data that he has collected from multiple states, the death records, coroner's reports, detailing, the extraordinary rise in sudden death. Like this is where that information can be housed and essentially kind of on the record within the government archives. It's so important. Any of the horror stories that you experience. Can I make a comment about how I was arrested at a school board meeting
Yes. Yes,
for
please.
my mask falling beneath my nose? Because as we know, masking was a countermeasure. Because
Yes.
as we know, the deployment of all of these protocols were military operations from day one, and they've
Yes.
been lying to us about that. So I can send my story over there, Sasha.
Absolutely, yes.
Okay.
We encourage stories like this. The government lied to us. They sent police to enforce masking and never bothered to explain to the public that these are countermeasures.
They also sent police to my house
Uh-huh.
to intimidate my children, to enforce a quarantine order on
Hmm.
my 12-year-old daughter. No, she was 13-year-old at the time. 13 years old. They came to my house on a Saturday, terrified my children, banging on the door, two
Hmm.
contact tracers, two armed officers, one from the New York State Police Department, the other from the Fairport Police Department. Devastatingly handsome Dr. Joy. I wasn't even home. All right. He goes out on the front porch and has like a showdown with like he's yelling at them and the neighbors are gathering and poor Peggy, our little neighbor, was like, "What did you guys do?" And I'm like, "Nothing." It was crazy. I have all
Uh-huh.
kinds of stories. I have all
Yeah.
kinds of stories.
Yeah.
Um, we're joined by Sasha Latapova. Make sure you support her over at her Substack, Due Diligence and Art. We have to take a quick break, but when we come back, I have more questions for you about medical freedom and some of the stories out in the news today. There's a lot of good news, but there's some bad news as well. A medical doctor now just an hour and a half away from me here in New York, outside of Syracuse, has been arrested. She is now charged with filing a false document or a false instrument, accused of faking vaccine cards for her daughter. She's facing now multiple years in prison. I have the story, but there are other things out here as well that I want to talk about with you, Sasha. You want to stick around for another 10 minutes or so?
Yeah.
15? That I want to read. And I want to do this because this is a question, Sasha, and you're one of the best to answer this question,
Hmm.
that I get all the time. And there is so much out there on the nanobots, the shots, what they injected into our bodies, and the nanobots, if they're in our bodies, interfacing with 5G, 4G. And, it sounds like insane, but given what they're saying about the technology out there, given what Elon Musk is saying about technology and where AI is going and how, AI is going to run everything. It's going to be smarter than God, smarter than humans, the robots. I mean, we're in this kind of weird dystopian space right now where I mean, very highly platformed influential figures are pitching, this new super transhumanist robotic future So people believe this stuff, but LT Oracle of Truth has a good question. Sasha, do you think that there are other technologies in the shot that can track you, trace and track you, or have internet connections, connect you to the internet and maybe control you? What are your thoughts on that? We'll start the questioning off there.
Well, so the last one, connection to the internet and remote control, no, technology like this does not exist. Okay, and it's not possible to inject somebody with this juice that's produced so randomly you can't they can't even keep track of what's in it.
Mm-hmm.
Yeah, so that's absolutely no. Now, as far as it tracking and tracing, well, sure, we microchip our dogs,
Yeah,
so
good point. Yep.
right, and that's an injection. So yeah, that technology exists, and there's like a but it's a reader essentially, like a scanner reader, like like those cameras that read your vehicle number, ID number, right, remotely or from space or whatever. I
Right.
mean, that exists.
Yeah.
But the same principle is behind. Yes, potentially through injections you can tag people somehow. I don't see evidence that that's in those vials, but I'm saying it's just in principle possible to do through injection.
Right. And we don't even have a very clear understanding, even now, of what is in those vials, what has been shipped out. We know, Sasha,
Hmm.
that in the rollout of Operation Warp Speed and the distribution, the military operation that was the distribution of the
Hmm.
shots, they're sent out to all of the pharmaceutical or all the pharmacies and the hospitals. We do know that different batches, different formulations, different types
Hmm.
of shots were sent out, perhaps even placebos. There are chances that vast swaths of Americans never even actually got the shot. They just got a placebo. We really don't know,
Hmm.
even now, 5 years later. Um, and so, there are certainly questions there, but it creates a lot of angst for people out there to think that, that this could potentially exist. What about graphene oxide? Do you have any thought? I see that all the time as well. People ask about graphene oxide and whether or not that could be in the vaccine. And if it is, what's the problem with that?
Well, I don't know.
Yeah.
As I said, because this is produced outside of any pharmaceutical law and regulation.
Mm,
Absolutely any ingredient can be in there. As far
right.
as chemical or yeah material like graphene oxide, it could be there. There are indications that it could get there through. There are some parts of the equipment that produces these products have graphene oxide and they could leak from there.
Mm,
The evidence that some commentators were publishing about, claiming that that's proof of graphene oxide, I've reviewed all of it. None of it actually proved graphene oxide in the vials. So as far as direct evidence, I don't have any. Indirectly, I'm saying because absolutely anything can be in those shots, it's possible that this material could be in the shots too.
okay. I mean, very frightening. And this is why, I mean, very good news. More and more Americans, and I think this is why this CHD petition is gaining a lot of steam. I think this is why the Trump administration has indicated. I'm going to go through some of the good news items here
Mhm.
because I have them laid out and I want to get your thoughts on them.
Mhm.
Um, because of our refusal to sit down and shut up, despite being called a hate group by Bob Malone, okay, and yelled at by everyone. All right. Because we have refused to sit down and shut up and we keep organizing and activating, we are getting some really good outcomes. And here are just a few. Even though it's limited, the HHS is now coming out saying that the Hep C vaccine is no longer recommended for children and babies. It's kind of a limited win, which I talked about with Mary Talley Bowden yesterday.
Mhm.
But you know what? It is a step forward. And in terms of optics, it's very good, right? It's creating seeds of doubt in the minds of many, many Americans, moms and dads. And that's leading to the next really good news item. More and more moms and dads aren't following the CDC recommended vaccine schedule, not just for COVID shots, but for all of them. And a Gallup poll, that came out in 24 said that the number of parents that said it was extremely important to vaccinate their children is down from 58% to 40% since 2020. And that was done in 2024, which is, I mean, this is power. This is
Yes.
huge. This is the culture. We had a really great Supreme Court ruling. The Second Circuit Court of Appeals dismissed a lawsuit against the New York State Departments of Health and Education that alleged they had violated the Constitution by ruling against Amish parents in New York who challenged the New York State school vaccine mandates, which do not allow religious exemptions. Then in July, lawyers, including Aaron Siri, asked the Supreme Court to hear the case, and the Supreme Court just handed down a summary disposition vacating the Second Circuit Court's dismissal. This is a huge win. This was reported by Health Freedom Defense. The Supreme Court just paved the way to restore religious vaccine exemptions in all 50 states. Mm-hmm. And it's massive. We also now have Trump signaling, whether he'll do it or not, we'll see, but signaling a review of every shot on the childhood vaccine schedule, which good optics. And then we have your petition with CHD, among other things. There's some bad news as well that I want to get to, but what are your thoughts about the state of medical freedom, given what we're seeing, and what do we need to do more of in order to continue to push this boulder up the hill so that we can hit the pinnacle and then just have it coming collapsing down, which is the goal?
Yeah, so I am particularly encouraged by the Gallup poll results, and I've seen similar results. Also, people are the normal population is questioning vaccines, and we know that it's only one way. When somebody starts looking seriously into vaccination, there is no coming back.
Yep.
They realize they have been duped for decades, for generations, and they do not come back from this discovery. So we know that it's only one-way direction, and that drop in how many people saw that it was super important to vaccinate their children is staggering in that short period of time.
Yeah.
And so that's the greatest news ever. Now, the actions of HHS about reviewing hepatitis B, yes, also in the same vein, just people even looking into why it's there and why is every pregnant woman treated like a prostitute and a drug user by our healthcare system. Right. That should be questioned. Why is every newborn baby treated like an intravenous drug user right away from first few hours here on Earth? It's incredible. It's absolutely incredible. And so just that question alone should be brought up to every parent, every new parent. And so that's great news. Now what ACIP did was just it's laughable. They just said, oh yeah, move this poison by 2 months. Okay, we still recommend it. Now that's not what yeah, so they're now saying and also this opens the door to testing, tracing, and bullying pregnant women even more, because they're saying if the mother tested negative, then maybe it's okay and to postpone for 2 months. That's in a nutshell what their recommendation is.
So they're saying now that the Hep C vaccine, they're still recommending the Hep C vaccine. They're just not recommending it for a brand newborn baby, but they'll shoot up your 2-month-old.
Yes, they're recommending it to 2 months old. So, but let me play through what actually is going to transpire in reality, because what everybody forgets, and I'm actually, my next research, full-blown research is going to be about this and probably come out in January. Right. I am looking into the financial incentives. Everybody forgets that the poisoner army, that are pediatricians, are paid to vaccinate, and also OBGYNs are paid to vaccinate. And those payments amount to very large amounts. They cannot sustain their business practices without it. And so what's going to happen now the OBGYNs are going to be the army, not at the delivery room, but a few months before, they will be catching up all these pregnant women saying, well, your baby cannot get Hep B anymore at birth. So you need to be protecting yourself and your baby now. So let's jab you with Hep B so that you have the proper titers. I'm telling you, this is exactly what's going to happen. So
Wow.
that's the next frontier we need to be addressing is those types of practices, the bullying, the predatory behavior that you have covered several times of those horror stories in the hospitals where the hospital system kidnaps the child and calls CPS on parents if they disagree with some sort of a harebrained, yet another, dozen interventions we need to do on your child. So that's what we need to be focusing on how to, because the system is designed to say, well, ACIP, those are just independent experts like Robert Malone, who just out of the goodness of their heart, volunteering and spending their hours and hours of work, traveling to these meetings and talking to us and providing their wisdom. But all of this is just recommendation. What do you mean? The doctor is now bullying and lying to the parents or lying to pregnant women. No, we don't do that. It's those bad people. We're just recommending. But guess what? Those recommendations go into the system that controls everybody. Every doctor is on the leash on that system. It's called, surprise, surprise, AIDS. Like AIDS like hell,
No
That's how that
way.
system is. Yes.
The HADES, the HADES system,
Yes. And
Hades.
that system, it's a collection of electronic medical records. Epic system feeds into it. All of this, it's basically, probably Palantir now has control of it. So that system is the one that tracks the metrics and decides whether you're a good doctor or you're a bad doctor, and do you deserve a bonus or you don't deserve a bonus on the vaccinations or other procedures. Not just vaccinations, it's everything, but vaccinations
Wow.
a big part of it.
Wow.
So that's how they're controlled. They're controlled literally by hell underneath that's hidden and nobody knows about, but it has leashes to all of those people to
Right.
yank them when they dare not to jab a person.
There are many mechanisms of control, and pointing to pediatricians, OBGYNs, general practitioners being financially compensated or financially rewarded for meeting certain metrics in terms of the vaccination of their practices, the people or the children who are in their practices, is a huge story.
Mm-hmm.
It is, the numbers are astronomical. We're not talking about a few $100s a month in a bonus.
Mm-hmm.
We're talking about millions of dollars. In fact, Dr. Mary Talley Bowden put out a tweet a month or two ago she calculated how much money she would have made if she had vaccinated 90% of her practice, and it was somewhere in the $1 million range, like over $1 million
Mm-hmm.
in her pocket. So she gave up $1 million and got hit with $250,000 in legal fees to defend herself and her practice, right?
Mm-hmm.
So that she could protect her patients. But multiply that by every practitioner virtually across the country.
Mm-hmm.
And we are looking at hundreds of millions, if not billions and billions of dollars that are being used to coerce medical doctors into coercing the people
Mm-hmm.
in their practices into taking these poison shots. And so what's happening at ACIP, it's getting a lot of play and a lot of coverage, and they're treating it as a win, but the mechanism is still in place. And the other way that they coerce these doctors is through like sheer force, like making their lives miserable.
Yeah.
If they don't comply, if they write religious or medical exemption or medical exemptions, and this is very evident. I mean, they're beginning to crack down hard here in New York State, Sasha.
Mm-hmm.
This is the headline from Newsweek. New York doctor accused of faking her son's vaccine record to put him into school. A New York doctor has been criminally charged and accused of faking her son's vaccine record in an attempt to get him into an elementary school, Syracuse.com reported. Shireen Ishmael voluntarily surrendered to authorities on December 3rd. Her attorney, Chad Davenport, told Newsweek. Chad Davenport has been on our show, and we actually covered her story. I was shocked. I mean, she has lawsuits pending already in New York State regarding her son and the state denying medical exemptions, multiple medical exemptions. I was shocked to see that they arrested her. We need to help this woman. She's a 49-year-old resident of DeWitt and practices at the Alexander Center for Children's Health in Manlius. It's a neighboring town. So this is horrifying. And she's facing many years she's charged with multiple felonies and she's facing prison time.
Yeah.
For making a decision about her son. Go ahead.
Remember they went after Kirk Moore with a similar zealous prosecution for issuing, fake vaccine cards, although his was in regard to the COVID shots. But I would encourage the attorneys to get in touch with Kirk Moore or just review his story, his case, because it is similar in many ways. And vaccines, the childhood vaccines, have a lot of similarities with countermeasures. They are actually, in practice, they are kind of like a countermeasures, always have been. They've never been regulated properly.
Right.
And so, maybe they can find some ways to capitalize on Kirk Moore's experience and fight this, because it's insane. It's insane what they're doing, and they're trying to make like real example of these people, treating them as these, I know Kirk Moore was facing 35 years in prison.
Yes, he was. Yes, he was. Well, and remember, I encourage her to stand up, speak out, and be proud. Yes. I encourage her to say, hell yes, I forged that record to uphold the Hippocratic Oath, and there are all sorts of ways that this case can go, and all kinds of defenses that she can mount. But the thing that brought down the prosecutors in the Kirk Moore case was the fact that they were getting way too close to having to talk about the fact that the vaccines were countermeasures, were military countermeasures. And as soon as that happened, and it was on court record, and these statements were being made, Pam Bondi swoops in, is like, oh, never mind. We don't want to have that. We don't want to discuss this case anymore. We're pulling it. It wasn't because she was doing something nice for Dr. Kirk Moore.
Oh, no.
It was because when you pull the thread far enough, you always get back to the military countermeasures. And that's the big lie that they want to protect. So I'll be in contact with Chad Davenport. I'm not even clear on what they're charging her of. I think it's a false instrument or a false document. But that's insane. I haven't seen anything like that. So we'll keep an eye on this case. I do have a question for you. Oh, go ahead.
I'm happy to speak with them as well. So with their attorneys.
Yeah, that would be great. I have another question here for you from the live chat. Sasha, what is the mechanism in the shots causing the long clots, the white fibrous clots, and the microclotting, in your opinion?
Yeah, so that's a good question. I actually published an article several months ago. You can probably find it on my Substack. It's in free access, talking about potential mechanism of these white fibrous clot formation.
Yeah.
And there are probably numerous mechanisms, but this is one of them. This was actually founded on the paper that was published, peer-reviewed paper published by UCSF, making a lot of imaging studies and different other studies, and claiming that these spike proteins from long COVID are responsible for this formation of these clots. And I reviewed the paper, and actually it does have a lot of good analysis, like as far as the experiments, there's good setup of experiments and visualizations. So what happens is, in our body, one of the most prevalent proteins is called fibrinogen. Fibrinogen is what's in your blood plasma and in other locations as well, but primarily in blood plasma. And in response to, this is what starts clotting, like normal blood clotting. In response to, let's say you cut your finger, this will initiate wound healing response, and locally it will convert fibrinogen into fibrin, very, very fine, kind of like spider-like fibers. They're
Right.
usually a single fiber. And these fibers create a mesh and they catch blood cells and they create the blood clot.
Right.
And when the wound has healed, there is a reverse, and the body will dissolve this fibrin and convert back into the fibrinogen.
Got it.
And so this is a reversible process. Now, you can make this process irreversible if you what's called in chemistry cross-link it. And this actually is used today in surgical techniques to create wound sealants and scaffolding and things like that, is using the body's fibrinogen, cross-linking it, and creating a permanent now fibrous structure that is not dissolvable anymore.
Wow.
So what happens is, yes, there is spike protein. Now, spike protein is not attached to any virus. There's no virus. Spike protein is basically a result of the cells collapsing and dying in mass, and there's a lot of this material. It's like debris. It's debris flying from collapsed cells. They also interact with lipid nanoparticles. They actually also collapse almost immediately, and they interact with body's native cholesterol, cellular membranes, and again, they contribute. So the UCSF paper visualized the spike protein as little pieces, like, little tiny bits. And these pieces get stuck into the fibrin fibers, and they become the cross-linkers. So they
Okay.
cross-link them, and they make
Okay.
a permanent structure. And if this continues for a long time, now you have this long. Also, it's not like while conversion is, either it's a liquid or it then becomes a solid, this fibrin to fibrinogen, but
Mm.
it's a process. It's a kind of spectrum. So you can have a blood that's sludged and solidified a little bit and becomes much more viscous,
Right.
and stays like this for a while. And it could be, these clots could be very, very long, but still in the liquid state. And
Okay.
so, but after that, when the zeta potential of the body drops below 11 millivolts,
Right.
they become solid. So
Got it.
that explains the phenomenon when they're saying, well, we found these, 24-inch long, or the whole leg long clot in a postmortem while I'm
Yeah.
trying to embalm. So it's definitely inconsistent with life. Like, how is it possible that this huge thing was there and the person
Right.
was still alive? Well, that's how, because it actually was in a viscous state, and it
Got
only
it.
became solid shortly, within 5 to 15 minutes after the zeta potential goes below 11, it becomes a solid.
Wow. 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 That makes a lot of sense. I do want to talk to you about Zeta potential, but we only have a minute left in the show.
Mhm.
You've done a lot of research on that as well, which I'm
Mhm.
really interested in the health benefits of like supplementing that or
Yes,
helping that.
yes.
So yeah, again, we only have a minute left. I'll have you on again. You're regular here on the Shannon Show. So
Okay.
anytime Sasha is willing to come on and bestow upon us her expertise on these matters, we will take it. You're one of the best
Mhm.
resources out there, Sasha. You are amazing. Um, Final moments. What do you want people to do in terms of this petition?
Mhm.
And final thoughts before I let you go.
Yeah, so again, I encourage everyone, let's continue the groundswell. We want to get to 1 million comments
Yes.
on this petition. We need to tell the FDA to do the right thing. So please share, please ask your friends, everyone to comment, provide public comments, submit your stories, and let's help this movement. And I will make sure that we stay honest on this, and I will
Yeah.
report what's going on and
Great.
continue collaborating with CHD.
Great. Great. We have pinned the link to the government document. It's
Mhm.
www.regulations.gov/document/FDA, blah, 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 blah. It is pinned on the live chat right here. So click on that link, share it everywhere. Anyone you know who suffered from a military countermeasure, the vaccines, the shots, the kill protocols, remdesivir, ventilators, masking, distancing, you name it. This is your chance to air your grievances. 5,000 words. You can tell your story and it goes into the record. It is documented. They have already garnered almost 200,000 comments in 2 days. This is going to be huge. Sasha Latapova, you were behind this. You have been diligent and you've suffered a lot for it. You've had a lot of haters and a lot of doubters, and you stood strong. I am so proud to be your friend. Thank you, thank you, thank you. This could not have been done without your amazing research. You're a champion. All right. So thank you.
Thank you, Shannon. Thank you, friend.
Yes.
We'll be in touch.
Absolutely. Absolutely. That is Sasha Latapova. Support her over. She's one of the most